Hey everybody, I'm Dana Bash with CNN, and I am so honored to be here with Dr. Kurt Newman, who is the president and CEO of Children's National Medical System, who has a really important new book, which I admit I haven't had a chance to read yet, but I'm looking forward to reading. It's called Healing Children, and it's a book making the case for the importance of pediatric medicine, which is very important. And it tells stories you have from being a surgeon now to CEO. I want to get to that in 1 minute, but because I'm actually going from here up to Capitol Hill to see what's going on with the Senate health care bill. What is your impression of the Senate Republican Obamacare repeal and replace bill vis-a-vis the people you care about most, children?
Well, thank you, and it's great to be here. I'm very worried because as I listen to the debate on Capitol Hill, you don't hear much about children, and the impact on children of the proposed legislation is possibly very, very devastating because, for example, at our hospital, over half the children are covered by Medicaid. So if we're, at a time that people are talking about cutting Medicaid, I think we ought to be putting more into pediatric medicine, more into coverage, and these cuts just would be crippling.
Was Obamacare good for pediatric medicine?
I think there was a lot of care? I think there was a lot of good in the Affordable Care Act. I think the elimination of lifetime caps, for example. I mean, a child with complex issues could blow through a cap in no time, and these things are with them for life, or pre-existing conditions. I mean, children with some very complicated things, or even not so complicated, but things like diabetes, mental health. Why would we want to have a system that where they're worried about that? We want them to be at their potential. So it's, I think, I'm very worried about what I've heard, and I'm also worried about the fact that there's not a lot of conversation about children. We ought to be talking about the impact on that, and doing more.
And if you were to get a question from a lawmaker, well, okay, how would you change the insurance system, which of course affects the healthcare delivery system?
Sure. Well, I'd make it more secure for children, and I would put a plan in place like we have for the elderly, like Medicare. Do that for children. So we have one plan. We don't have all these different plans in each state, but we have something that kids can count on. We do that for the elderly. Why not for children?
Fascinating. Well, let's talk about your book a little bit. First of all, I should say that U.S. News just came out with the top children's hospitals, and Washington Children's Hospital is in the top 10.
Yeah, which
doesn't surprise me as a Washingtonian.
We're very excited about that, and about the fact that our neonatology, our babies, was ranked #1. So
wow.
It was big.
Wow, that is huge. Well, congratulations.
Thank you.
It's from hard work, I know that. But on this book, why did you write this book, and just give a sense of what the message is in it?
Well, over the years as being a surgeon, I would get these calls and from friends, from different people, and to be honest, I kind of got angry because I would find friends, parents that were in situations that I knew were preventable. And so what I wanted to do with the book was to describe and empower parents with the knowledge that I'd gained after 30 years of being a surgeon, to empower them to take action, and so that they would learn and appreciate the special value, the priceless value of pediatric medicine, children's hospitals, specialists, emergency departments for kids that they just didn't know, and sometimes didn't know till it was too late.
Give me a prime example that every parent, somebody like me, should know.
Sure. So your kid is on the playground and has a fracture or breaks a bone, and so the question is, where do I take him? And so commonly I would get calls, and someone would have taken their child to an emergency department that was mainly for adults and didn't have the specialists, didn't have the equipment, didn't have the say the radiologist that knew the difference about what the special needs of children and their growth and all of that. And so they'd say, well, I'm here and what should I do? And they don't have this, that, and I would think to myself, why didn't they just go to a pediatric specialty center like a children's hospital? They do all the research for their kids, for schools, for their soccer teams. Why not do that in advance for their children? So in the back of the book, I have some tips for parents, but one of the big ones is be prepared and do the research ahead of time. Know which emergency department focuses on children and has a pediatric anesthesiologist on call or has the right equipment. That's what we're there for. And so that was the purpose, so that you as a mother, you're not trying to make that decision in the moment, but you already have a plan. Just like you would if there's a fire in your house, the plan. You'd have a plan for the emergency
and as
department.
you're saying it, I'm thinking, right, why don't I have that? It doesn't make any sense.
Well, people just don't think about it,
right.
And then you don't think about it. That those are not the times you want to be thinking about it.
You want to have it ready to go.
And I would say, well, maybe take a drive to that emergency department ahead of time and see where you're going to park, who you're going to need to talk to, just like you would for anything else. And I think you'd be ready and in that moment to say, oh yeah, I know where to go. Yeah, maybe it's a little further, but boy, is it
better. And
better.
On this note, we have a question from Stacy out there who asks, if my child has to be taken to the hospital in an ambulance, can I request a children's hospital?
Absolutely, and I think you want to know and maybe even take a step further back and talk to the emergency medical system where you live or where your school is, and kind of press them. Say, well, what kind of preparation do you have? Where would you take my child? But you can certainly request that. Now, there may be times where they just have to get to the nearest hospital to stabilize things and then but it is your right, and that's one of the goals here, is so that parents can advocate for their children.
It's so important. One other thing that you discuss is the high percentage of children with mental health issues who aren't treated. Is that, do you think, because there's still a stigma, or because it's not recognized in kids in the way it is in grown-ups, because kids sometimes act out? I mean, what's the reason for that?
Well, I think there's a number of reasons, but I think stigma plays a big part in that. People just don't want to talk about it or think about it. And maybe it's not recognized as much, but over 20% of kids will have some type of mental health or behavioral health issue during their time. And the time from when symptoms first start till when they're diagnosed is on average about 8 years. There's so much that could be done early if we're screening for it, if the pediatrician is looking for it. But really what it comes down to, too, is the mother's intuition is usually spot on. I know the dads, we need to talk about dads, but and I have a chapter in the book about moms and their intuition and how important that is. And the biggest mistakes I made as a doctor sometimes were not listening to the mother and not engaging the family into what was going on. So back to mental health, those clues, and the pediatricians are on that, and then making that early determination. And we, as a country, we need to get past this stigma and do more for kids with mental health issues and behavioral health issues.
Veronica asks, getting my child a blood draw is the worst experience ever. How do they do it differently at Children's Hospital to make it a better experience?
A great question, and I think it goes to the whole patient and family experience, where the blood drawing folks, that's all they do. And so they have a sense about children and what makes them comfortable. And it's rare that you have to go beyond sometimes sedation's required, but it's rare to have to go too far beyond that.
But you all know how to deal with kids.
And
you do it every day.
We do. We have a guy at our hospital named Albert. People come from all over for Albert because he is so good at this, and it's all set up. And I think a lot of it also has to do with the experience. So you walk into a children's hospital, people say to me, well, you know what, it must be really sad. You know, it must be depressing over there. And it's not, it's the opposite. There's music, there's art, it's a happy place. We want children to have that kind of experience so that they're relaxed, and if there's something difficult, at least there's stuff around to take their mind off of it.
Okay, Josephina asks, in an emergency when one is not able or does not have time or ability to research, how can one pick the best price? Price or place? Maybe it's place for what he or she needs. Guessing it's place.
Well, that's tough, and you know, that's where the research ahead of time does come into play if you can do that. I think in a tough emergency situation where time is of the essence, you just have to rely on the providers to make those decisions for you. But that's also there's a time before that where you could be advocating for the emergency departments or for the emergency technicians, the ambulances, to be ready. What sort of resources do they have for children?
It's important. Innovations are underway at Children's to give you the most up-to-date technology, not just in medical research and providing medical care, but even things to, as you said, sort of make the kids feel more comfortable, more at home. What are you doing?
Well, you know, part of the things that any children's hospital is doing, and ours is really at the forefront of this, is around innovation and research. And for example, one of the areas is around pain, and to try and make the procedures less painful, to actually even measure pain and get away from those having to check the funny face to actually a technology where we can measure pain and know what works and doesn't work, so we can give the right medications or the right approaches, because pain is just such a big part of things, and we want to make surgery more precise, and we want to make it less painful. I think one of the great things about children's hospitals too is that there's a lot of things that we don't know, but we take the potential and the resilience of children into play. And I'm reminded of one of the stories of a kid I took care of who came in with probably the worst kind of liver cancer, and his survival would have been, if you calculated it out, 5 or 10%. It had replaced half his liver. It had spread through his body, and he was going into high school. So I operated on him, and we removed about 99% of the cancer. But I left there feeling defeated, because with cancer, 1% is, it's a big deal, and it's probably going to come back. Well, this kid, we didn't write him off. We gave him all the chemotherapy. He was such a champion. 5 months later, he made the baseball team with his Portacat that the chemotherapy was going through in place. And then 2 years later, he carried the Olympic torch here in Washington, D.C. And, I just got a call from him. He got engaged. He's got his MBA. He's working in New York. But that's the thing. The resilience of children and how his liver grew back, the chemotherapy worked, but there was something more, and we're trying to harness that now with immunotherapy to help the body's immune system to eradicate. There's so much on the horizon, and there's so much that research can turn on. That's why I really worry when we talk about these, cutting the budget or cutting the NIH budget. It seems the wrong way. There's so much more that can be done around research and innovation for children.
I'm sure, absolutely. Okay, let me just get another question from out there. Let's see. Okay, Leslie says, a friend recently had a child at Children's and told me about great private rooms and games in their rooms. Do all kids have rooms like that at Children's?
Well, I think most children's hospitals are moving in that direction. I'd say, we're not totally there. We're about 90%, because I think it makes such a difference to be able to have the family comfortable, the family involved with the care of their child, and if places for people to be comfortable while they're sleeping. We've got a setup now where kids can order food at any time.
Wow.
Yeah, it's a big deal. And it's healthy food, obviously, and it's appropriate to what the child needs. But I think the question is a very important one, because healing involves more than the medical care. It involves the all the pieces that come around to allow a child to heal and reach their full potential.
So, just one last question, and I'll let you go. But for people who don't really understand the benefit of having a children's only hospital, a hospital that just focuses on the needs of little ones, how would you describe how important it is vis-a-vis just sending a kid to a regular hospital where adults are treated as well?
Well, I think I've had the experience myself with my own children, and I've seen behind I've been on the front lines. I know what goes on, and there's just no question that it's different. If you think about your child having anesthesia, you want an anesthesiologist that's what they do. That's all they do. You don't want somebody that may do that a couple times, a week. If you have a child that's had a fracture, for example, you want an orthopedic surgeon that knows and thinks about not just the bones that are broken now, but what's going to be needed when that child becomes a teenager or an adult. So that's the concept that I want to get through in terms of the book, is that these hospitals, these specialists, they're focused not just on the moment for a child, but they're thinking about that lifetime. And I had a young man, I met him as a newborn, and I got called in. I had just started my career. And I called my boss because I hadn't seen this before. All his intestines were on the outside. He was a newborn baby. I wasn't quite sure how to put everything back, in the right way and what to do. Called my boss. He hadn't seen it before either. He told me I was on my own. Anyway, we took care of him, and 22 operations later, I don't know how many times he's been in the hospital. I never thought he'd make it through high school. I went to his high school graduation.
Wow.
He made it through college. I never thought that he'd, have a girlfriend or whatever. Tyler, he got married, and I was at his wedding.
Aww.
And 7 months ago, and this was the most incredible miracle, I never thought he'd have a child. He's got a 7-month-old son who's as normal as anything. So you want to be at a hospital, and I've got a little prop here. I mean, and this is going to be shameless, but this is a 3D printed copy of a baby's heart, a newborn's heart. This is what our heart surgeons operate on. So when you think about that, you want specialists that know that size of a heart and have everything that can take care of it. But they're also thinking about, what is that heart going to become, and what is that child going to need? And you want anesthesiologists, you want child life workers, social work. You want a team that's with you for the rest of your life, and that's what a children's hospital can bring.
Well, it is a magical and important place, and I know that is thanks in large part to your leadership. So thank you so much for spending time with me, and thanks for writing the book.
Oh, it's terrific. I just wanted to say that all the proceeds go to research, so to help find those innovations in research.
That's
but
amazing.
It's been a tremendous honor to be with you today.
Thank you. Thanks, Dr.
Thank you.
Newman. Appreciate it. Bye, everybody.